Okay.
So hopefully she'll be on in a couple minutes here. This is Kate Van Heist. I'm Jason Adams. Um, well, just thank you for taking your time to do this. We really appreciate it.
It's my pleasure. I enjoy helping you guys.
That's awesome. Thank you. How long have you been
Yeah.
coaching, Dr. Paul?
Yeah, 4 years.
4
4
years?
years now. Yeah. So I practiced like for 39 years actually, but yeah, I've been coaching for 4 years.
That's
It's been
great.
awesome. I practice. Yeah. I'm glad to
Yeah.
share with you.
Like, how'd you, now, is Doug your personal coach or is
Yeah.
somebody else?
Let's see. I'm probably 5 levels in depth from Doug.
Oh, okay.
Yeah, but
Okay.
we communicate quite a bit.
Yeah.
Yeah,
Okay.
we communicate a lot. Yeah. So he's sort of been a mentor of mine
That's
long
great.
ago.
That's
Yeah.
great.
As well as Paula Holt.
Okay.
We
Yep.
do a lot.
We
Hmm.
love Paula.
Yep.
Oh, she says she's here.
Okay. Great. Well, she should be hopping on here in a second. So I actually have with another coach, we are doing a presentation for a clinic next week.
Oh, great.
Yeah. Yep. And I don't know if you might just have like one or two tips on, because we're going to just do a little slideshow course. Maybe if you had any tips on how to approach that or just kind of see where it goes, maybe.
Yeah, absolutely. Yeah. Are we all on now or we're still? No, okay. Yeah. Yeah. Actually, when I started, we decided to have a meeting in my office waiting room. And so we invited some patients, and actually 18 showed up the first time, which was really cool. It was a room full. And yeah, we just did a PowerPoint. Just at that point, we just did one of the PowerPoints, the standard PowerPoints, and answered questions. But as far as setting up, the main thing, I guess, is just to invite people. Invite it like anything. Invite as many as you can.
Yeah.
Because and as a physician, you have a little bit of leverage over your patients, like with medical issues and that kind of stuff. Tell them it's going to be, if they have diabetes or high blood pressure, what have you, which is why I decided to start doing it in my medical practice, just to help my patients get healthier, get off of medicine and that kind of thing. So the physicians have a little more leverage over their patients than maybe, otherwise. So to get them there, so they can see the value and the benefit to themselves to get them there. So it makes it a little easier to get your patients to come to a meeting. So
Yeah. Yeah. Well, this meeting is actually just our initial meeting with the doctors.
oh, gotcha. Oh, okay. It's not a share meeting. Okay. Yeah, absolutely. Now, is it a clinic then, or a
Yeah,
group
it's
of
a clinic. Yep.
Yeah. Main thing is just show them the first of all, the value to their patients. Because most people, they're probably looking at it for two things. One is to help their patients, and others probably maybe as a profit center, increased income.
Right.
So,
Right.
yeah,
That's kind of
those are
what we
the,
thought. Like focus more on getting their patients results and just like you said, getting off medications and things like that.
yeah. So I would approach it by showing them the value to their patients that they can get them off of medicine. It works great for diabetes. I mean, it really works. Well, I've gotten a lot of patients off of their diabetic medicine and cholesterol and I see Dr. Ron is on.
Yes, here she is. Can you hear us? It's all
Oh,
the
press
audio.
the audio.
Hi.
There we
There
go.
she is.
Okay. Everybody then.
We
Good
do.
morning.
Good morning.
Waiting on you. No.
How are you?
Hey, good morning. How are you?
Yeah.
Well, this is great. Well, Dr. Paul, it's Dr. Rana, and she's been doing amazing on program, down almost 60 pounds, feeling great. But she is interested in coaching and obviously wants to help some people because, as we all do, we love this program. But she just had some more specific questions on the middle side. And thank you again for taking your time. We really appreciate it. And now I'm going to mute.
Okay.
Sit back.
Okay. Yeah. So, hey, I can just chat. Dr. Anna, how are you?
I'm good, thank you. How are you?
Fine. So I'm a family practice doctor.
Oh,
And
okay.
I practiced like for many years, and we've always looked for ways to help our patients, like you have, mainly a lot of times they needed to get weight off, with diabetics. My typical patient
Right.
was diabetic, hypertensive, high cholesterol, maybe heart disease, arthritis, low back pain. Not all together, but quite often.
Yeah.
I don't know if your practice is.
Yeah, yeah.
It's sort of very, and overweight. And so, the usual approach we took over the years never really worked, like counting calories. They'd hand out diet sheets and say, follow this and exercise, send them to dietitians. There was one other at Lutheran Hospital in Fort Wayne. I'm in Northeast Indiana, by the way.
Okay.
Had a program that people lost weight, but it just, they all gained it back. It was really not a good system. So we really never had a good way. And so I've been a coach for 4 years, and one of my patients who was an overweight diabetic on Januvia, which is getting too expensive for insurance premiums for going up. And she came in and she'd heard about this program and wanted to make sure it was okay. So I looked at it, found out it had been studied and used at Johns Hopkins, which is big for me. It looked really good. It looked safe, nothing wrong with it. And so she tried it. And then when she came in 3 months later, it was like a wow experience. Nothing I've ever seen. All of her numbers were normal. A1C was high to normal, everything. And I was able to get her off of all of her medicine. And at that point, I was 60 pounds overweight, like for about the 100th time, because I'd yo-yo diet. I tried everything and I lost and gained it like a lot of people. So, I had a big overhang and my buttons were tight and I had to come up for air when I tied up my shoes, just the usual kind of thing, shorter steps. So I tried it myself. And compared with everything else, I really love the program. It was really, because you've been on the program, it was so simple, it worked. And
True.
a couple of weeks, I felt great, and I decided to offer it to my patients to see how it would work with them. And so I offered it to a few, and it seemed to be well accepted. Then we had decided to have a meeting. So we had a, patient meeting, like a program overview. And we had 18 patients came, and it was sort of a good start. So since then, I've really helped a lot of my clients, and now I'm getting a lot of referrals from other doctors. Doctors. Yeah, believe it or not.
Yeah. So, well, no, I totally believe it, because I have had a couple people come back in for a 3-month follow-up. And, with OB, it's different because you get to know your patients, especially if you're a woman and they're women, you bond at a different level. So I've had patients come in and say, girl, what are you doing? Because that kind of girlfriend thing, and I really, all I said was, I'm eating healthy, and of course, I'm adopting the habits of health kind of thing. And because my big thing is, I've been on a couple of other Facebook pages and groups, and there was somebody who was some sort of a medical professional, and what she wrote down was, I don't want to put all the degrees in front of my name in jeopardy by trying to do the health care provider coaching. So I just coach as, any other person who's gone through the experience, and not advertise that it's part of my, medical regimen. Because really, I'm thinking, because just like the rest of our profession, if you stand behind something, then you pretty much put your whole reputation behind it. Mm-hmm. So, that's another big thing. Do I want to be called, the OB that also does weight loss, or do I want to be just the OB who gives advice on how to do it like everybody else does, Yeah.
Well, there is a large OBGYN group in Fort Wayne called Fort Wayne OBGYN.
Right. And, I know them. Yeah.
You know them? Well, where do you live?
So it's a long story, but long story short, I did a 2-year no compete clause, and I went to Northwest Indiana. So I was in Chesterton with, I don't know if you know her, I think it's Lisa, I forgot her last name. And it was a 4-physician group. So I was with them. So we saw patients from Fort Wayne come in once in a while. Yeah.
They have their own weight management, weight loss program. It's fun. Fortunately, not ours.
Right.
Them, but they're kind of settled in, and I haven't given up, but they've settled in with another program that they're using and invested some time and effort in that, so they don't want to change it, but they have no problem. Fort Wayne OBGYN has no problem offering.
Is that there's an Indian guy in it, right? Is that the group?
Yes. Oh yeah, I believe so.
Yeah, and there's the other guy who does a lot of Urogyne, because I think I interviewed with them when I was interviewing initially.
Yeah.
years ago to come back to the Midwest. Yeah.
Okay. And it's kind of funny because we've talked to other doctors, and it's funny that some of them have the wrong attitude as far as I'm concerned. Like one said, I don't want to take advantage of my patients. Well, that's sort of to me, a funny attitude if our goal is to help them. I mean, and
right. But, the thing is, though, yes, that's another concern, because if you're going to offer something, it's going to be through your portal. And then, like, do you advertise? Like, do I put my before and after picture out there, like life-size cardboard pictures?
Yeah.
Like, come see what happened, that kind of thing, so.
Yeah. Well, my feeling, I practiced independently for many years before becoming employed, but and when I practiced independently, I felt like it was helping my patients a lot. So I did put up some posters in my office and BMI charts.
Right.
And a Habits of Health book in each room, and it was well received. I mean, people would go in and they'd be looking at their BMI chart and they'd say, "Oh, I'm not even on this. I'm off the top of the scale." Like, they were interested. It didn't seem to be an issue. They said, maybe I better have a look at this. So, and then when I became employed, which was like 3 years ago, with our local hospital, I told them I wanted to keep doing it. And they wrote that into my contract that I could continue to do it as an independent in their office as an employee, but I had to give them a little disclaimer that said that I'm offering this program, that I believe it has advantage over others, and that I'll make income off of it, and they're okay with that. And most patients, I show them the form, and they just, "Oh, that's fine," and just signed it. I found from my patient point of view, there was no problem with them accepting it and thinking there was any conflict. They were just happy, to
have something,
explore something else.
Right.
So from that point of view, it never worked. And again, my hospital, which first of all, they said they weren't sure about it, because you know what it's like if you're employed. And I said, well, I'd like to still do it. And so they worked it out. It worked fine. They had no problem with me doing it as an employed physician.
Right.
Offering my program to my patients and keeping that as a separate income.
Yeah, no, I'm independent, so I won't have that.
Good, okay.
So, and I'm a solo practitioner, so that's the other thing. And I'm OBGYN, so you can imagine how much sleep I get.
Yeah. Yeah.
So that's my other thing, with OB, as it is, the malpractice is like really, really high. So I just wonder, if it will have any ramifications on.
No. In fact, when I became employed, they had they checked with their malpractice carrier, and they sent a letter, confirmed in writing that it was not going to be an issue. They didn't think it would increase the risk, because there were no drugs or prescription medicine or injections. There was nothing like that. They were concerned if it was going to be giving injections or some kind of. The main thing was
there
weight
is a
loss.
family practice group in the area who does those HCG.
HCG, yeah. They just wanted to make sure that I wasn't going to be prescribing weight loss drugs.
Right.
As long as they knew it was nothing, it was just a nutrition program and coaching. Right. The malpractice company was fine. They covered me.
So how do you go around the coaching part?
Okay. Well, as I said, I have posters and BMI charts and some information in each waiting room, and each exam room, and in the waiting room too. And so when I see them and think they could benefit with the program, I just mention, first of all, I mention it to them, explore it with them. And if, say, that we have this program you should look at because I think it'll help, I show them usually a little 5-minute video of the program overview. It was like a Take Shape for Life one, and maybe we should have one that was done. I just have a little DVD player in the office and show it to them, and some of them look at it and say, usually some of them just say, fine, I'll try it, and then right on the spot they're ready to give it a try. Others, they want to think about it, so I follow up with them, just give them a call, and we have a monthly meeting that it's sort of a health and hope where we invite everyone, the public, but also patients and people who are interested, so they can come to that as well if they want to check it out. So I just integrate it. For me, it's just a natural thing, because before I would just say, okay, here's a 1,500 calorie diet, follow this and exercise, or we'll send you to a dietitian.
Right.
Now, this is an option for you. If you want to have a look at it, this is another option. and they kind of feel really comfortable that I'm the one who's doing it actually.
Right, right. Yeah, exactly. Coming from a physician, it's a different thing.
Yeah, exactly.
Yeah. Okay. Well, I know that, there were some, like I said, there were some patients who did ask, but again, is the cost a factor for people?
It is for some. It's like the same with patients as it is with everyone else, who clients who aren't physicians. It's the same issue, and it is for some and not for others. So I just, use the usual, the same approach, discuss it with them like, there's lots of training on that, like, what are you spending now on food, and kind of go through that if they want, and I tell them the value if they see the value, and with physicians we have the advantage like of getting them off of expensive medicine perhaps, or even insulin. That's a real incentive for patients. In my practice, they feel if they can get off of their insulin or off of some medicine, it's worthwhile, and they say, well, yeah, I'm spending all this much on medicine,
right?
It's not gonna, if I can get off of that, it's not gonna really make much difference. But it is with some people, like it is in the general public.
So that would be the other thing that I would have to communicate with their primary or internal medicine physician.
Yeah. Well, in my case, actually, I'm getting referrals now from other doctors. 2 family practice doctors, an orthopedic surgeon and a general surgeon, have referred their patients to me. And so I just send them like a regular, like a referral letter, a kind of like a letter back that you would anyhow if they referred you, just to let them know they're on the program. And I tell them that I don't interfere with them, with their care of the patient, that I guide them on the program, because in Fort Wayne Lutheran Hospital, I said, has a weight loss program that I don't really like. And a lot of doctors have been referring to that. So it's sort of the same kind of thing. They refer, and then so I would just send a letter back to them saying, your patient has decided to try this program, however you want to word it. But I make clear that I'm not interfering with their primary care physician, even though I'm a physician.
Right.
Yeah.
Okay.
And that I just, manage them.
Do you follow up just like we would follow up otherwise?
Yep.
Like, or so?
I just treat my patients as any other client, like with the text and the calls, get them into a good fat burn. And I find it's fun. Like even though I was real busy too, I found it was fun. I found time to do it. Just kind of working. It doesn't take much time. Yeah. So I just coached them as I did any other client who was not a patient. Exactly the same way, except if they were my own patient, I had a little bit of more leverage and insight. I could guide them on their medicine adjustment and all that. But if they went to another physician, then I made sure they checked with their physician and had them guide any medication changes as they lost weight.
Okay, so this sounds encouraging then.
Yeah, to me, it's been a real blessing. I mean, I love it. It's really rewarding. And in fact, I actually decided to retire. So 2 months ago, I retired, but now I'm doing more health coaching. I'm continuing to do it full time. Oh, yeah. And since I retired, I've been getting more referrals than ever from others, which is kind of interesting. Yeah. So no, I really enjoy health coaching. I did talk a little bit about business. Like when I first looked at it, of course, I wanted to help my patients primarily. I was looking at it as what they call, profit center. And
right.
Managers, like we did EKGs in the office and offered other services as well, because you know what it's like with, reimbursement from insurance company kind of thing shrinking. And that's another angle too, if you want to talk to other doctors, because, and Jason, you may not be aware, but insurance companies are really, as Dr. Rana will know, they don't pay as well as they used to. Sometimes they don't pay well at all.
Yeah, exactly.
It's awful. And so doctors are looking for another income stream, another source of income in their practice to help compensate for that.
Mm-hmm. Yeah, and that's the other, you're so right, because you hit it on the nail on the head, because my brother-in-law is also an OBGYN. He's an REI, in fact. So he keeps telling me, he's like, why don't you do cosmetics? Why don't you do this? Why don't you put in a laser machine? And I'm like, I'm not that kind of a doctor, I'm a doctor.
I know.
I'm not one of those fluffy doctors.
Specialty groups are offering all kinds of things like dermatologists are offering cosmetics and all kinds of things as in their office, in their practice. So it really, I think it's more and more, I've had no trouble with it being accepted in my practice and by other doctors as well.
Right.
It was a bit of concern too when I started, the reflection on my reputation and all that, but it really integrates well. I think if it were another business line that didn't quite integrate so well with medical practice and helping our patients, it might be different. But this is a real good fit. I mean, it just fits really well for what we do as physicians.
And that's the thing, that really, I think it does make a difference,
Mm-hmm.
So it really, and it honestly does. And there are people out there, a lot of them like me who think, there is no way it's
Mm-hmm.
possible to lose a big chunk of weight unless you're thinking about surgery.
Mm-hmm.
Yeah.
Yeah. That's another thing
definitely.
too. Yeah, I've had more than one client, patients, and referrals who I have one nurse actually. It's so ironic. Her physician and employer
Mhm.
shared the program with her, and he was one that said he didn't want to take advantage of his patients.
Right.
So one of his nurses is my client because she was recommended to have bariatric surgery and she didn't want it. So I
Right.
think that's the irony. Just kind of kills me that.
Yeah, that's true.
That she's working, and actually and then I have two of his nurses in as clients that are in his office, and he didn't like the program. He didn't want to take advantage.
Yeah.
The irony is killing me. I mean, it's just
Yeah.
so anyhow.
Did they do well?
Yes, very well, and
Yeah.
and one of my very first clients wanted bariatric surgery, and she fought with her insurance company. We tried to get coverage for a year, and they wouldn't do it. And she finally agreed to try the program after a year, and she lost 138 pounds
Oh, wow.
on our program. Literally, we had heard stories. It just changed her life so
Yeah.
dramatically. She became a coach to pay it forward.
Yeah.
And so no, patients who are interested in bariatric surgery are considering it. This is a huge option. I'd much rather they try this than have a surgeon rearrange their insides,
Mm-hmm.
all
Correct.
the complications that go along with surgery.
What do you find the patient population that takes up to do the program insurance-wise?
Oh, yeah, and as far as insurance coverage of the program?
No, not the coverage, but because of course they're going to be paying with their own money for the stuff, So
Yeah.
Is it more commercial insurance patients who agree to do it, or do you think everybody, like the state insurance patients, are also going to be interested, or
Yeah,
would they do it?
Yeah, the patients on Medicaid typically are less interested.
Mm-hmm.
And they're the ones who often need it the most.
Exactly. Yeah.
But because of their lifestyle and they may not have much disposable income, but it's the same thing. If they're hugely overweight, they're eating something. I mean, they can't tell me that they,
Right.
I think it's in my experience, people who say they can't afford it, often it's an excuse, like they're not ready, or they haven't seen the value. Because these people are hugely overweight. I mean, they're 350 pounds. They didn't get there, and they're not sustaining that by eating nothing.
Right.
They'll tell you that, I don't spend that much money on food.
Right.
I don't believe it. So anyhow, but the Medicaid population, the state supported kind of the mindset and all that is that they often are not interested,
Right.
but other people are more interested. Yeah.
Okay.
You have a lot of Medicaid patients, or?
I know. I'm talking about. I see Medicaid only for like OB patients and not for YN.
Okay.
So you see patients who walk in and they're 12 weeks pregnant and they weigh like 312.
Yeah.
And you're like, oh my God, this is going to be an interesting pregnancy. And not only that, they continue to gain weight throughout the pregnancy.
Yeah.
So so it's. And sometimes, they really do want to lose weight, but they just haven't found anything, because most of them who do get pregnant are the ones who are actually exercising and trying to eat right. And lo and behold, they got pregnant then. So I was just wondering if that's also going to be a patient population to target.
Yeah. I mean, ones who are pregnant now.
No, after they're done.
Yeah. Oh, yeah. Absolutely. Because one of the we're not supposed to use it if they're pregnant, as you know, the
Correct.
program. But yeah. Oh, absolutely. After. Yeah. In fact, one of the surgeons in Decatur who's been referring patients, she got on the nursing mother program. She knew
Oh,
about
yeah.
the program after she had a baby,
Right.
and she loved the program, so she's referred her own patients to me she wants them to lose weight before doing surgery, elective surgery.
Right.
Yeah, absolutely. Oh yeah, after they have the baby, that would be an awesome time to
Right.
have them get on the program. Absolutely.
So I think you've covered pretty much everything I was worried about.
Mhm.
So I think I'm going to think about it
Oh
and
yeah,
want to proceed.
yeah. I'll be glad to chat with you again, or
Yeah.
if you want to help, because it's been really. I mean, to me, it's been very good, very worthwhile. I love that it was a lot less stressful than the medical part of the practice in a lot of ways, and more fun. It was more
That's
fun.
for sure. It is. It
Exactly.
is. Yeah.
Yeah,
Yeah.
now that I've retired, I mean, I'm doing more. I'm health coaching full time now after retiring 8 weeks ago, and
Yeah.
loving it. I mean, it's really a lot better than practicing medicine, to be honest with you.
Wow. Yeah. That's the problem. I'm sure I'm a junkie at some level because you get into OB for the rush.
Yeah. Okay.
Yeah.
But
So.
a time will come when maybe you decide it's time to.
But yeah, so this kind of looks similar to me that, I think there is that success thing, that you can be proud of when
Yeah.
other people make it. So, yeah, I think that part might be satisfied right there. So,
Exactly. You bet. Exactly. If I got to a point where I mean, I love practicing medicine, obviously, a family practice, and I did OBs for a while and did some procedures and that kind of stuff. But it gets to a point after a while, like it was time for a change. And you
right,
have to get to
right,
that point too. Maybe if you're a health coach sooner than later, you'll like health coaching more.
right. Who knows? Yeah, that's true.
Okay.
So, yeah, thank you so much for your time. And I'll probably be in contact with you then.
It's my pleasure. Anytime you want to set up a call or anything, I'll be
Yep.
glad to help you. Okay.
All right. Great. You so much.
You're welcome.
Thank you,
Thank you
Dr.
so
Paul.
much, Dr. Paul. Thank you.
Okay. See you later.
Bye.
All right, guys. We'll be in touch, Dr. Anna.
Bye. Talk to you later.